Well, maybe that's a nicer way, because although this is a new therapy, there's actually been two other novel therapies for sickle cell disease. And again, names, I'm going to attempt to say them. The first one is crizanlizumab, or as Mary so eloquently said, we just call it Criz, and everybody knows what we're talking about, and voxelotor. But these were withdrawn after a very short period of time. And so, Stephen, if I could go back to you first, and then I'm going to go to you, Mary. But Stephen, what has been the impact of having these therapies and then having them withdrawn in terms of the clinical side and the practice when you're seeing patients with sickle cell disease?
Thanks, Charlie. We started writing the Perspectives article in Hemisphere after the withdrawal of crizanlizumab, which was in January of 2024. And we kind of were trying to get our heads around, what is the impact of this? And actually, it took us more than a year. It was close to a year and a half by the time we ended up publishing it. And part of the reason for that was that so much changed over that time. So we sort of wrote something about that, and then voxelotor got approved. And then just as we were getting our heads around that, voxelotor got withdrawn. And then just as we were getting our heads around that, exa-cel, which had already been rejected by NICE, then got approved. In terms of what was actually going on the ground for people experiencing this, it was really chaotic.
Absolutely. And Mary, please, this sounds like a massive roller coaster when you've got all this coming on. You're given the promise of a new therapy which can alleviate some of the symptoms or side effects from the current therapies. You move to it. Then you're withdrawn. I mean, how is that for the community?
So it's really difficult. The first thing to remember is the two treatments that we spoke about earlier, blood transfusion and hydroxyurea. If we focus on blood transfusion for now, because as Paul rightly highlighted, there's such a reluctance in the adult and patient base around hydroxyurea and the longer term impact or side effects of the medication. If we look at blood transfusion, it's reliant firstly on blood donation and the need for the blood donation from particular groups, like ethnic groups within society. Blood donation levels are low. So what that means is even with patients with sickle cell who are on voxelotor and Criz, there's already a struggle for access to blood products for the sickle patient base. And so the sudden withdrawal of both of those treatments then compounds the issue further because there isn't enough blood products for the patient base. Against the backdrop of that, the emotional toil for the patient